Brucellosis, also known as Malta Fever or Mediterranean fever, is a bacterial infection that affects multiple systems in the body. It's caused by Brucella species, small gram-negative bacteria that live and multiply inside human cells. Humans can become infected in three main ways. 1. Through direct contact with infected animals, like cattle, goats, sheep, or pigs. 2. By consuming unpasteurized milk, cheese, or other dairy products. And 3. By inhaling airborne particles, which is a particular risk for lab workers handling the bacteria. Today, brucellosis is rare in high-income countries thanks to food safety regulations and animal control programs, but it's still endemic in many parts of the world, including the Mediterranean region, the Middle East, Latin America, and areas of Asia and Africa. The Brucella genus includes several species that infect different animals. Brucella melitensis, commonly found in goats and sheep, and it's the most virulent species in humans. Brucella abortus, which primarily infects cattle. Brucella suis, associated with pigs. And Brucella canis, which is linked to dogs and is less common in human infections. Once inside the body, Brucella bacteria are engulfed by macrophages, but they don't get destroyed. They survive and multiply by preventing fusion between the phagosome and lysosome. This clever trick allows them to spread through the body, especially to organs in the reticuloendothelial system, like the liver, spleen, bone marrow, and lymph nodes. The result? A chronic inflammatory reaction, often with granuloma formation. Brucellosis can present in different forms. It may be acute, subacute, or chronic. A classic hallmark is an undulating fever pattern. The temperature rises in the evening, then drops by morning. This wave-like fever may last for weeks or even months. Common symptoms include fever, chills, and night sweats, often with a distinct musty odor. Fatigue, loss of appetite, and noticeable weight loss. Muscle and joint pain, especially in the lower back or hips. In fact, musculoskeletal issues are the most frequent complications, including sacroiliitis and spondylitis. In around 5% of patients, the infection spreads to the nervous system. This is called neurobrucellosis, and it can cause meningitis, encephalitis, or even depression. Endocarditis, or infection of the heart valves, is rare, but it's the leading cause of death in brucellosis. Other possible signs include an enlarged liver or spleen, swollen lymph nodes, testicular inflammation, and in some cases, hepatitis. Diagnosing brucellosis starts with strong clinical suspicion, and it must be confirmed with lab tests. The gold standard is a blood culture, or cultures from bone marrow or other tissues. However, these can take up to 4 weeks to grow. Serological testing is also useful. The standard agglutination test, or SAT, is most common. A titer of 160 or higher usually indicates active infection. ELISA testing can detect IgM and IgG antibodies, and it's helpful in both acute and chronic cases. PCR testing provides rapid results and is especially valuable in chronic or relapse brucellosis. If the patient has localized symptoms, such as back pain, always evaluate for organ involvement. MRI is recommended to detect spinal complications like vertebral osteomyelitis. Treating brucellosis means targeting intracellular bacteria and preventing relapse. The WHO and CDC recommend combination antibiotic therapy. Start with doxycycline, 100 mg twice a day, plus rifampin, 600 to 900 mg daily, both for a total of 6 weeks. An alternative regimen uses doxycycline with streptomycin, 1 gram intramuscularly each day, for 2 to 3 weeks. For complicated cases, like neurobrucellosis or endocarditis, add ceftriaxone and extend treatment to at least 3 months. Sometimes therapy is continued for up to 6 months or longer. Even with proper treatment, relapse occurs in 5 to 15% of cases, most often due to poor compliance or stopping antibiotics too early. There's currently no vaccine for humans, so prevention is key. Start with pasteurizing dairy products to eliminate the bacteria. Vaccinate animals, especially cattle, using approved strains like RB51. People who work with animals should use protective gear to avoid exposure. And in labs, always follow biosafety protocols when handling Brucella. Because of its zoonotic potential and risk as a bioterrorism agent, brucellosis is a notifiable disease in many countries. Let's review the key takeaways about brucellosis. Brucellosis is a zoonotic infection caused by bacteria that live inside human cells. Always consider it in patients with fever, especially if they've had contact with animals or have traveled to regions where the disease is common. Joint pain and neurologic symptoms are some of the most frequent complications. Diagnosis relies on a combination of tests: blood culture, serologic tests, or PCR. Treatment typically includes doxycycline and rifampin, taken together for at least 6 weeks. Recognizing the disease early is critical because it helps prevent serious complications like osteomyelitis, neurobrucellosis, and endocarditis. Thanks for watching this episode on brucellosis. If you found it helpful, make sure to like, subscribe, and tap the notification bell so you never miss a new post. Here on Medotonin, we make complex medical topics simple, visual, and easy to remember. Check out our other videos for more on infectious diseases, clinical reasoning, and high-yield medical learning. Stay curious, keep learning, and remember, always think zoonotic in patients with unexplained fevers.